Jack.
Those are paid for by funds that are coming from the foundation of AARP.
Okay.
And but that's a different issue. What I would love to be able to explain to you is that throughout the time that health care reform has been on the table, AARP has sung one song. It doesn't have many notes. We asked the government for 6 things to be included in the health care plan. We're still singing that same song. We have not, as an organization, bought into any single bill. Not the House's, not the Senate's, not anybody's.
Right.
Now, I'll grant you this, and it was a very unfortunate thing. The President misspoke. He recognized to the public that he misspoke and apologized for it. No, we're not backing his plan. And the truth is, he doesn't have a plan. He hasn't taken the time to write a 1,000-page document.
You're right. It's basically Congress's plan.
But I'll say this now, there's so much misinformation.
That's the key.
That's being tossed out there that's confusing a lot of senior citizens. But again, I want to emphasize that AARP is a senior citizen advocate group. And we have stayed steady through the course this entire time that health care reform has been on the table. We've asked for 6 things: guaranteeing access to affordable coverage for Americans aged 50 to 64, closing the Medicare Part D donut hole, preventing avoidable rehospitalization and improving patient care by providing people in Medicare with a follow-up care benefit so that they can transition to home and not come right back into another hospital stay. We've tried to, we've advocated the increasing of federal funding and eligibility for home and community-based services through Medicaid so that older Americans don't have to live necessarily in nursing homes. If they can do it at home cheaper, that's great. We need to help them out. We also are trying to create access to generic versions of costly biological drugs that treat all sorts of things from cancer and other serious illnesses. But those biological or those generic versions are simply not available right now. And lastly, the last thing that we've asked for is improving programs that help low-income Americans in Medicare to afford health care and prescription drugs that they need. We haven't wavered from that message.
You know what's wonderful, Jack?